Hello, Assalamu alaikum. In this video, we will understand about the varicose vein. What is the varicose veins? Let's understand about all these things. The chronic venous insufficiency. The chronic venous insufficiency means the insufficient vein function, and the prevalent in adult population is estimated to be 5 to 30%. The severity of chronic venous disease is closely related to magnitude of venous hypertension, and it is venous hypertension and the 25% women and the 15% men. It means the women more than the men. Let's understand about the mechanism of the varicose vein. This is the varicose vein mean our vein which that collect the blood deoxygenated toward the heart. This is the descending aorta after the oxygenation through a oxyhemoglobin, which that provide the oxygen to the tissue and go back toward the heart. When go back toward the heart, the deoxygenated blood will enter into the right atrium to right ventricle, and this is the oxygenated blood and more blood pressure. No valves are present as compared to the vein, and 120 millimeter of mercury is the blood pressure as compared to the vein. Vein is less. Vein is 80 millimeter of mercury. Anyhow, let's understand about the vein. Basically, the vein blood move against the gravity. That is why the walls gradually present, and which that will not allow to move back flow of this blood, and the thin wall of vein as compared to the artery and the valve in vein here, and the deoxygenated blood and low blood pressure. The varicose vein is the basically the abnormal blood flow due to the deformed wall, and this a skin bulge and thin wall which that show in the skin. So remember that things, basically it is the damage of the valves of the vein, and the damage of the valve of the vein which that will lead to backflow of the blood, will lead to more damage of the valve, will lead to basically is not linear vein will occur, but it will zigzag manner. Sign and symptom is the skin bulging due to swelling, and this will lead to we can identify, and the hyperpigmentation can occur in the skin. Here you can see this the hyperpigmentation and the skin bulging by the varicose vein. And this is basically, here you can see this is below the skin is the vein which that allow the blood to move back into the heart, and this is a correctly functioning valve, while this is the incorrect. It means the venous reflux will occur, and this is the skin and the incompetent valve and backflow of the blood. The skin trophic changes, venous hypertension, and the prevalent disease process will occur. The legs vein discomfort and legs ulcer and the cellulitis can occur. On the other hand, the edema on the arm, on the feet, etc., and skin bulging will occur already, And on the other hand, the basically is the arm vein mostly, and the delay wound healing and recovery will basically delay wound healing and recovery due to the varicose vein. Anyhow, let's understand the further function. So in this way, here is the basically risk factor is the family history and the obesity. On the other hand, the female sex more, and the age and multiple pregnancies and standing for long periods daily basis. On the other hand, the epigenetic also involved, but less, not more. So the evidence of the epigenetic is the weak. The causes of this varicose vein is the inflammation, obesity, and infection, and the trauma. On the other hand, the malignant tumor and the radiotherapy and surgery, as well as disease. Other disease basically related to the cardiovascular disease. Remember that things. The treatment we will discuss in the last of this video, but first we will understand about the diagnosis as well as the lymphedema by chronic venous insufficiency. The varicose veins will lead to problem the lymphedema by chronic venous insufficiency. Let's understand about that. Basically, the lymphatic fluid is required the circulation completely with the each cycle of the blood, and in this way, the remember that things, the lymphedema will lead to cause the appearance or sign of symptom is the swelling of the face, neck, and the genitals, as well as arm and leg. On the other hand, the hemoglobin leak by vein into the extracellular matrix to become hemosiderin to brown appearance. You can see in this diagram here is this image. This is the hemoglobin leak and will lead to hemosiderin. Anyhow, let's understand about this is the vein which that immune system activation to inflammation will occur. On the other hand, the incomplete flow of the lymph which that are present in the vein will not enter completely or sufficiently into the again circulation from the clavicle vein. In this way, the increase the lymphatic fluid in the body and not clear the lymphatic circulation and skin tissue changes, and in this way edema can occur, inflammation, and the accumulation of protein rich fluid and no circulation well will lead to cause inflammation, and that inflammation will recruit the more monocyte as well as leukocyte, neutrophils, innate immune cells, which that will lead to progress. The inflammation is known as chronic inflammation. This chronic inflammation will lead to cause many complications like damage of the blood vessel. More, the venous ulceration can occur 5% population due to the varicose vein. The diagnosis of the varicose vein is differently. The several tests we can use, but in this video we will discuss the ultrasound here and the Cals test as well as angiography. Angiography is used for the identification like a coronary artery heart disease or other type of disease. So we can collect the angiograph and get the image for identification where the problem is appear. The coloration test as well as the sphenofemoral junction will feel for thrill, and the incompetent valve test if the feel for thrill, and on the other hand the cough test and the on the other hand the Trin Playberg test and the Parthis test. On the other hand, the skin cellulitis test, if present, it means. On the other hand, when you will put the hand and check this test. On the other hand, the pump cough muscle, if no appear, it means the deep vein no affected. It means we can see that. If we will pump the cough, we can show the varicose vein. The complication is the prolonged and heavy bleeding and the superficial thrombophlebitis and the deep vein thrombosis. On the other hand, the treatment, let's understand now the surgical removal of vein and the supplemental procedures and physiological therapy, the physiotherapy and the compressions and stroking as well as the structured exercise program and complete decongestive therapy and the intermittent pneumatic compression. This is the all video about the varicose veins. I hope you make sense about that. Varicose vein is the problem in the vein and which that will lead to not linear but the zigzag manner. And in this way, the show the varicose vein which that cause problem like blood pressure of the vein will be drop as well as on the other hand the backflow of the blood which that will lead to cause lymphedema and other chronic diseases. Thanks for watching. See you in the next video. Bye. Please make sure to subscribe, like.